Hi, I am Professor Dr. Prabhat Kumar. Today I would like to talk why the knee is the commonest site for osteoarthritis if osteoarthritis is degenerative joint disease. The knee joint is the unique organ that is both load bearing and weight bearing with ground reaction force and body reaction force goes across the knee in ambulation stance. Thus, the knee joint is receiving physical forces from both above and below and is the center for all sorts of forces and stresses. The knee joint can withstand all these forces and stresses as long as the bone mineral density, strength of the muscles, and other supporters like ligaments of the knee joint are normal. The knee is a load bearing joint rather than weight bearing. Most of the load of the knee doesn't stem from the body mass but from the strength of the contraction of the periarticular muscles and the strength of the adjacent bones. Load bearing capacity of the joint is good when there is no osteoporosis and no sarcopenia. As you know, all the knee joint is a triple bone joint formed by the three bones, the lower end of femur and the upper end of tibia and the patella, and got triple compartment that is patellofemoral, medial tibiofemoral, and lateral tibiofemoral compartments. And also, it is a triaxial joint. The motion in the knee is not that of a simple hinge, flexion and extension. Flexion and extension of the knee are accomplished by both rolling motion and gliding motion between the femoral and tibial condyles. In addition to flexion and extension occurring in the sagittal plane, there are concomitant abduction and adduction occurring in the coronal plane, and internal and external rotation occurring in transverse plane. There are certain risk factors which can lead to the damage of the joint. That is overusage of the knees as a part of the profession and part of lifestyle, and due to some injurious physical activities. Other risk factors are like overweight, sarcopenia, osteoporosis, malalignment with alteration in mechanical access. The normal knee joint can support a lifetime of repetitive load without the development of mechanical changes, but sarcopenia and osteoporosis may increase shear stress at the bone and cartilage interface, precipitating cartilage degradation. Osteoporosis is the principal cause for the collapse of subcondylar trabeculae, especially in medial condyle tibia, which receives load, lead to subcondylar sclerosis. Thus, viscoelasticity of the subcondylar bone is lost. It in turn leads to increase in peak adduction moment, which lead to deviation of mechanical axis. Forces transmitting across knee joint further lead to rise in intra-articular stress. Excessive loading of joint will lead to subcondylar bone collapse before it produces obvious damage to articular cartilage. So, cartilage damage was preceded by subcondylar bone collapse. Fact to be accepted. Here you can see clearly the X-ray knee APV shows that the joint space looks good, but there is subcondylar sclerosis due to subcondylar trabecular collapse. And you can see the shape of the middle condyle is altered and it is collapsed, and some osteophytes are formed. Osteoarthritic changes are clearly shown, but still you can see the space is appears to be good. Our study reveals osteoporosis and sarcopenia playing a major role in the progression of osteoarthritis of knee. So, movement is life. Our basis research in osteoarthritis is the prevention of progression of osteoarthritis rather than treating damage of articular cartilage. Thank you. Take care.